Hello and welcome to NAFDAC and Your Health. Here we bring you up to date with NAFDAC's activities with regards to its mandates of safeguarding the health of the nation. I am your host. My name is Tosin Adebayo. The attainment of the Level 3 WHO benchmarking tool has given the agency and indeed the country the pride of place as a leading regulatory body on the continent. As NAFDAC continues to improve and upgrade its capacity to deliver on its mandate, the agency also works with other regulatory and health bodies across the continent, collaborating to strengthen regulatory capacity and activities across Africa. It is on this backdrop that the Ugandan delegation visited NAFDAC on a study visit. The delegation, comprising representatives of the Ugandan National Drug Authority, were received by the Director General, Professor Mojisola Adeyeye, in Lagos. The Director General welcomed the delegation and gave an overview of how much reforms have had to take place in NAFDAC since she stepped into her role as Chief Executive, and that restructuring isn't limited to the laboratories and other frontline sections of the agency, but that to achieve the sort of attainment that NAFDAC has, there has to be a thorough and holistic overhaul of the entire system.
In between, procurement, finance and accounts, human resources all fall under regulatory system, one of the 9 functions. Because if your finance and account is not good, there is no way that the technical will be good. If your administrative structure is not good, there is no way the technical will be good. So that is regulatory system. Others include market authorization, registration of products, market control.
Members of the delegation thanked the DG for the warm reception and indeed the success tips she shared on how to improve regulatory activities in their home country.
I think we really want to thank for the excellent reception that we received when we arrived. We were met at the airport. The team also has been with us throughout. They have received us very well. So much as we talk about the technical things, we should also appreciate the excellent reception that we received.
First of all, I'd like to congratulate you, NAFDAC, for having attained number 3. We are very happy that the continent are among those that have attained it. I'd like to thank you also for sharing your story with us. Certainly we shall be able to implement the areas that you have been able to share with us so that we can also be able to attain. One of our ways we have experienced is regarding regulations and the act for it to be renewed. Maybe we just ready to like how we managed to push to have a number of regulations and indicators, so that we are able to achieve them. Because that's one of the areas where we are falling short, and it's outside our jurisdiction. We can't do much. And then also regarding financing, we talked about the salaries offered by government and then the other activities. Maybe just clarify that they are using money at source. Just clarify that. And then regarding the track and trace system, how is it working in Nigeria? Just very we are very happy to be affected.
The reception ended with a photography session, after which the delegates proceeded to NAFDAC Central Drug Laboratory in Yaba, Lagos, to begin their study visitation proper.
What NAFDAC is doing, especially in the laboratory services, we are developing a laboratory as a national drug authority in Uganda, and we thought there's a lot to learn from Nigeria because they are at an advanced level.
The week-long study visit will allow the Ugandan delegation understudy firsthand NAFDAC processes from laboratory activities to track and trace and the use of technology.
But we have tried to put the package of a good package for you that we make the convenient and make it as comfortable as possible. The study visit from the team from Uganda is actually a week-long program, and the primary purpose of that visit is a benchmarking exercise, and we have put together a number of programs that we intend to follow throughout the week. Some of the things we are going to be sharing with them are the quality management system we operate in the laboratory. We are going to show them the added technologies. The lab is run on LIMS, Laboratory Information Management System. It's a software that we use to run all the laboratory processes from the beginning to the end, from the moment we receive sample and when samples are being tested in the laboratory. Everything is digitalized, and we can follow and track that progress throughout the stay in the laboratory, even if it is in retention. So we are going to equally share with them some of the test scopes that we have been accredited through our ISO 17025. Those test scopes, we demonstrate some to them and let them see how we carry out the analysts actually perform these tests in Nigeria. Also, we are going to look at they have requested that they want to find out about the track and trace system of the agency, the journey so far. If you do recall, Nigeria was one of the first few countries in the world that have embraced and deployed track and trace system to monitor the distribution and use of medicines. So it's equally important that we share our knowledge in this regard with us brothers from Uganda. And most importantly, we are going to equally show them and share with them our experiences during the benchmarking exercise, global benchmarking exercise that led to Nigeria being awarded maturity level 3, because laboratory function is equally among the 8 functions of NAFDAC that were benchmarked for maximum global benchmarking for maturity level 3. So these are some of the things we are going to roll throughout the week.
We'll take a short break now. Don't go away.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family, and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction (ADR). On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the Watch List tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. You're watching NAFDAC and your health. The head of quality assurance at Central Drug Laboratory Yaba gave the delegation a rundown of the history of NAFDAC laboratories as well as their functions.
In NAFDAC, we have 7 laboratories, and Central Drug Control Laboratory happens to be one of those 7 laboratories. The laboratories are located, we have 3 in Lagos. We have the Central Drug Control Laboratory, which is where we are now. We also have the National Control Laboratory for vaccines and other biologicals, still on the same building. We have another laboratory in another part of Lagos, Oshodi, which is a food laboratory. Then when we leave Lagos, in the southern part of the country, we have a laboratory in Port Harcourt. In the east, we have a laboratory in Agulu. In north-west of Nigeria, we have a laboratory in Kaduna. Then in northeast of Nigeria, we have a lab in Maiduguri. So those are the 7 laboratories in NAFDAC. And CDCL, that's the Central Drug Control Laboratory, is one of them. But Central Drug Laboratory happens to be in the Laboratory Services Directorate for Drugs and Biologics. And the head of the directorate is our director here, Mr. Abiola. The lab commenced operation in 1978 under the Department of Food and Drug Administration of Nigeria Federal Ministry of Health. So it started as a unit in Federal Ministry of Health in 1978. For this visit, they are here for the entire week. But for today, we're just explaining to them or telling them what Central Drug Control Laboratory, NAFDAC, is all about. We talked about how we started. When this laboratory started sometime in 1978 as the unit in the Federal Ministry of Health. And when NAFDAC was formed in 1993. That was when officially it became Central Drug Control Laboratory for Drugs and Vaccines. But sometime in August 2009, the laboratory was split. We now had two laboratories, Central Drug Control Laboratory and the Vaccine Laboratory. So currently in this building, we have those two labs. So for our laboratory, this laboratory is just one out of the 7 laboratories in NAFDAC. But it is also one out of the 3 laboratories that make up the Drugs and Biologics Laboratory Services Directorate. We have 3 of them. This laboratory, Central Drug Control Laboratory, Yaba. We have the National Control Laboratory for Vaccines and Other Biologicals here in Yaba too. Then we also have the 3rd laboratory, is our laboratory, the area laboratory in Maiduguri. So these 3 labs make up the Drug Services Directorate. Those are the 3 labs headed by Mr. Victor Abiola as our director. Then in the lab, we have also shared to them our structure. The number of units we have as headed by the different heads of units and the director heading. We have the testing and the non-testing units also. The staff strength here, were 82 personnel working here. 72 of them are technical staff, while just 12 are the support staff. The discipline are widespread. We have biochemists, we have chemists, microbiologists, pharmacists, vet doctors, and others that are science-based. We also have engineers here because we have an instrument maintenance unit also. And of course, we have the quality assurance unit that supports the QC activities in the laboratory. Equipment-wise, the agency have spent so much in retooling the lab so that we can have state-of-the-art equipment. Some of our obsolete equipment have also been boarded so that our tests are accurate and also reliable. We collaborate with a lot of agencies, a lot of partners, both the national and international ones, USP, the WHO, Global Funds. We have done a lot of surveys with them, the Malaria Initiative, the tuberculosis, the maternal and child care, and even inside NAFDAC too. We've had a lot of surveys with our own directorate, that's the post-market surveillance too, to carry out QC post-market surveillance activities. We also partner with the West African Health Organization. Currently, they are doing this cross-border quality monitoring of medicines, and when those medicines are sampled, they will also be tested in our laboratory. As you all know, this laboratory has currently achieved the maturity level 3 of the WHO global benchmarking. And part of our next plans as a laboratory is to engage on activities that will help us sustain this, also sustain our ISO 17025 accreditation. The lab has been accredited since 2015. We also plan on acquiring our WHO pre-qualification so that this laboratory will be pre-qualified. We've engaged now on risk-based testing to make our services effective, timely delivery of test reports, manage our resources also better. The laboratory is also a regional center for regulatory excellence for quality control and quality assurance of medicines. So we also need to build on that strength to build capacity for other regulators and even non-regulators in our region. So that was what was shared with our Ugandan visitors today. Tomorrow we intend to continue telling them what this laboratory does and our journey towards the maturity level 3 of WHO global benchmarking.
In a highly informative and interactive session, the Ugandan delegation got a deeper understanding of how NAFDAC is able to harmonize its activities across the country, issue certificates, and monitor compliance.
We have harmonized all our procedures. We have harmonized documents. These SOPs we are using here, the same SOP they are using over. So all the activities are actually harmonized. And we have joint accreditation for our 5 laboratories now. We are working towards Nigeria now, hopefully this.
Is it that each of the labs with the different director has a different mandate? Or are there some which have the same mandate, but each one is headed by the director?
The mandate as in product type analyzed
Yes,
is different.
It's different.
It's different, yes.
We are not producing vaccines yet, but we are looking at building that capability because the challenges we had during COVID, we thought that we should have capability within Africa, working with others on our own to develop vaccines. So we look at the partners within the region and beyond, like in West Africa, if we can work together, so that we don't depend on Europeans, because the last epidemic they let us down. We couldn't get what we wanted at the right time. So we are also looking at herbals. I don't know herbal medicines. That's also we're developing that because we think Africa is rich in having the herbal medicine, so we can develop that to have quality drugs.
Here is where we draw the curtains on this edition of the program. Join us same time, same station next week for another informative package. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food products peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Importing, producing, distributing and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activities in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.